All right, it's 5 minutes past the hour, so I think we're going to get things started here. Um, Thank you, everyone, so much for coming to today's Lunch and Learn on neurobiology and gender-based or intimate partner violence with Christina Fifield. Um, my name is Frankie. I am subbing in for Tyler Colborn, who typically, is involved with these. But very happy to be here. So I'd like to start, of course, with a land acknowledgement. So I would like to begin by acknowledging that I personally am presenting near Wagwalteach, or end of the bay ending without a river coming in, also known as the northwest arm of Halifax, which is located on the ancestral and unceded territory of the Mi'kmaq people. The inherent rights of the Mi'kmaq were recognized in the peace and friendship treaties signed with the Mi'kmaq, Maliseet, and Passamaquoddy peoples from 1725 to 1779. Crucially, this series of treaties did not surrender Indigenous land, resources, or sovereignty to the British Empire, but instead established rules for an ongoing relationship between nations. Canada later reaffirmed the treaties in Section 35 of the Constitution Act, and they remain active to this day. So I'd like us to take some time to pause in reflection and gratitude for the land where we live and work. So as well, we want to make sure that we have invitations to move from acknowledgement into action. So just take some time today to think on how do you show gratitude for the land? What does it mean to practice reciprocity? And what is the history of how you came to be on this land? And how has colonialism supported your arrival? We also want to make sure to bring up, of course, reparations for people of African descent. The history of people of African descent in Nova Scotia is marked by resilience, contribution, and profound influence on the province's social fabric. From the Black Loyalists and the Maroons to the Southern American Black refugees, the legacies of these communities have indelibly shaped Nova Scotia's cultural landscape. Their stories, marked by perseverance in the face of adversity, are central to our shared history and both recognition and restitution. So the 2026 theme for African Heritage Month, which has already passed, of course, but which we want to sort of take into the rest of the year as well, is strength and unity, moving forward with purpose, prosperity, power, and progress. So, of course, you can see here the college firmly recognizes that reparations are both a moral and material obligation to atone for the deep-rooted history of anti-Black racism within Nova Scotia and the broader Canadian context, which has led to human rights violations and crimes committed against people of African descent. So, further than reparations, we have restitution, compensation, rehabilitation, satisfaction, and guarantees of non-repetition. All of these are crucial to truly enacting reparations for people of African descent. So before we get started, I just want to have a little check-in in the chat so everyone can quickly drop their name and pronouns. The land that you're on, you can easily access that through place names, and your practice area, uh, as well as how you're arriving, what's in your heart, mind, or spirit as we start this call, and what motivated you to join today. So I'm also just making sure to include these in the chat. But yeah, feel free to sound off in the chat um, about any of these. So, for instance, I'm Frankie. I use he, him pronouns. I am not a social worker. I'm the administrative support for application services at the college. I'm arriving excited and a little bit nervous to be facilitating here, but eager to learn. And what motivated me to join today was helping out my coworkers, my colleagues at the college, and facilitating for all of you. As well, I just want to make sure that members of NSCSW know that they can choose to track this as formal professional development and use your registration confirmation email or PDF ticket as a verification document. And you can visit our website for more information about the updated professional development requirements. As well, we want to remember that decolonizing and politically educating ourselves are forms of protection, self-love, self-care, and community care, which is why professional development and is, so crucial to the profession. So today, you can also make sure to access today's presentation afterwards by using this QR code. There's also a link that Christina has helpfully provided us. But with all of that, I am going to turn things over to Christina so we can get this presentation started. Thank you so, oops, let me get back there. Thank you so much, Christina. Stop sharing here.
All right. Can everyone see? Frankie, can you see my presentation up? I can see it. Can you see it?
I
Yes.
can.
Perfect. All right, Frankie, thank you for the introduction and thank you for everyone that's joining today. My name is Christina Fifield. I use pronoun she, her. And I'm a trauma therapist and gender-based violence advocate. I've been doing this work for going into 18 years now, and hoping today might be helpful. Oftentimes, with talking, when I'm asked to talk or train about intimate partner violence, gender-based violence, this conversation around neurobiology usually gets like not included in the conversation. And I just think this is such an important conversation, such an important topic, and having an understanding of how individuals are impacted by intimate partner violence and gender-based violence. So hopefully some of this will be helpful today, and very curious if you had feedback um, from this presentation, let me know. I invite all feedback. It's an important part of my learning and continuing to do this work. So I'll get started here with maybe inviting you just for a moment, because today we'll be talking about the impact of violence, what it has on our nervous systems, what it has on the nervous systems and bodies of people that are impacted, but also talking about our exposure to the work that we do each and every day as social workers or as helpers in the professions you might be doing. Um, an opportunity to turn inward. So, if you're curious, you might just connect with your body right now, possibly noticing, if you would like, maybe your breath, noticing that you're breathing. You might bring some intention to your breath, or you might just simply notice your breath right now. Another way of possibly connecting with your body is by noticing the rhythm of your heartbeat. And one way of doing that might be by placing your hand over your heart and just noticing the rhythm of your heartbeat and possibly what your heartbeat might be telling you in this moment. Maybe you are, running to this online lunch and learn. Maybe you've had a very busy morning, or maybe you're just starting your day. So, what is your heartbeat telling you in this moment? And possibly what emotions you might be noticing, and you might possibly be noticing no emotions at all. And if you're noticing any sensations in your body or feelings. So maybe it's Thursday, it's been a long week. You might be noticing heaviness or tension, or maybe you're noticing lightness, or maybe noticing a little anxiety, whatever might be coming up. Just spending an intentional moment just checking in with your body. The practice of checking in with your body and nervous system is so important, I believe, in working with survivors and communities impacted by violence and gender-based violence. And hopefully by the end of over the next, 45 minutes, that will become more clear. So why that might be important. So why is neurobiology, neuroscience, and attachment, why does it matter in gender-based violence work? Understanding trauma and gender-based violence requires more than understanding the events, and it requires understanding that violence, what violence does to a person's brain and body, what it does to their relationships with others, and what it does with their sense of self and their relationship with their self. Violence fundamentally alters a person's relationship. And I see this all the time in my work as a trauma therapist. And it also impacts a person's relationship with other people and the world that they're living in. And just important to name that gender-based violence is about power, control, and disempowerment. Gender-based violence is a relational trauma, and it can cause injuries to a person's brain. And the impact on a person's relationship with themselves and a body, it can really cause significant changes. It can change their sense of safety within their body, their ability to trust their emotions, their instincts, and their body cues, what their body's telling them, what they need. So that has to do with interoceptive awareness, which I'll talk a little more about on a upcoming slide. And it's the ability to recognize needs, feelings, and internal sensations. It can impact our sense of ability to identify worth and agency. And it can really disconnect a person from feeling connected, from being able to experience things like pleasure, rest, and self-compassion. And this last point here on this slide, I think a lot of people, there's misunderstandings, there's myths about this, but many survivors of gender-based violence, intimate partner violence, including sexualized violence, learn to disconnect from their bodies. And this is a survival strategy that they often, and it's an adaptive survival strategy that happens because of the violence that they are experiencing. So there's many people that have experienced violence and abuse that what I have come to learn as a trauma therapist that don't even recognize anything about their body, feeling very disconnected and living outside of their body. So violence erodes a survivor's sense of agency, autonomy, voice, and trust in themselves. And too often survivors are told, either directly or indirectly, that their needs, choices, feelings, and boundaries do not matter. And that continues to get reinforced um, through the relational trauma, whether it's with a partner, whether it's with a family member, or it's violence they might be experiencing at work, or within their friend group. So the impacts of violence can leave survivors feeling disconnected from themselves, others, and limits their capacity to make decisions. Why does this matter when you think about our role as social workers and, showing up and working with survivors that have been impacted by violence? Because of their experiences, violence can shape how a survivor shows up in our space, in our workplaces, the work that we're doing each and every day with them. It can impact their ability to trust others, including professionals that are trained and trauma informed, right? Because of survivors' experiences with injustices and harms, it's very hard for people to trust. They've experienced so much, often trust ruptures with the systems and people that are supposed to help. So they have a really difficult time trusting a person. It can have an impact on if they seek services or receive support. Um, Survivors can have difficulty with navigating boundaries, experiencing intimacy and connection, and their perceptions of threat can be greatly impacted by their experiences with violence. So they interpret safety and threat in relationships and their surroundings. And this does something. This. Um, the neurobiology and neuroscience parts of this are really important in understanding how a survivor is showing up in front of us. So, why this matters to us, recognizing survival responses rather than symptoms and behaviors is really important. By understanding neurobiology, neuroscience, and attachment, it avoids pathologizing adaptations to violence, which we often see in healthcare settings, our legal system, other services where survivors and victims might be interacting with. It creates the conditions that support safety, agency, and healing. And when we have this understanding of how trauma impacts a person's body, brain, and nervous system, it really changes how we respond and possibly responding with curiosity and compassion, which is really needed in our work with survivors of intimate partner violence and gender-based violence. And reconnection and healing is about supporting survivors to reconnect with their bodies, their values, their strengths, their needs, and their choices. And by empowering them, it involves creating conditions where survivors can reclaim agency and self-determination. So, how we understand how violence shapes their nervous system, their relationships, and sense of self creates the conditions and in our practice to better understand the survivor that is in front of us. If you're taking anything away from this today, this slide, I hope you might possibly, I invite you to possibly reflect on this, reflect on how your body and nervous system is showing up in your work. Maybe you're not working a lot with survivors of intimate partner violence and gender-based violence, but overall your work, right? How does your body and nervous system show up? And how our body and nervous system shows up as social workers or helpers, it does matter. Caring for our body is an essential part of trauma care and working with survivors. And it has taken me, I'm going to say, for many years in doing this work on the front lines of intimate partner violence and gender-based violence work. This was not a part of my practice. And really, when I started to become a therapist and learning about trauma, learning about the impacts of trauma exposure on my own nervous system and within my colleagues, this part, I believe, is one of the most important parts of working with survivors. So caring for your body, it is an essential part of trauma care and working with survivors. Why? So why it matters? Well, neurobiology, when we look at what happens to a survivor and victim that has been impacted by violence, it does things to their brain. So when we have a diagram up here, there's lots of different diagrams that can help you better understand how trauma impacts the brain. If your neuroscience scares you in terminology, I'm going to try to keep this simple. But basically what happens is with the repeated experiences of violence and abuse, whether that's in an intimate partner violent relationship or in another form of gender-based violence, or possibly those experiences with trauma and abuse started early. So I call that attachment trauma or developmental trauma. Earlier experience as a person, as a child has experienced, that does things to a person's brain. It really shifts what is taking place. Oftentimes, a person's prefrontal cortex can be offline, right? Including when a person, when the person's in front of us and working with them. So have the question up here. Are you aware when a survivor or a victim that you're working with, when their frontal lobe is offline or online? And if you don't know that, that is something that's really important. I do training with folks like around recognizing that and, especially doing intakes when we're doing consent forms, when we're doing work with individuals, right? When they're saying yes or no, are they making an informed decision? Are they consenting, right? Is their frontal lobe online when they might be saying yes or no? Right? Are they able to integrate the information being shared with them? And too often, especially in the initial phases of work with folks, or when people are in crisis, so they're fleeing violence, they've been in a violent relationship for a very long time. Oftentimes, a person's prefrontal cortex is offline and it shrinks. Other parts of the brain that are really important to understand when it comes to trauma is the amygdala. Sorry, I have a hard time saying that word. So basically, it's the smoke detector. And what does trauma do to a person's, this part of the brain is that it puts the brain on like permanent alert, right? Because of a person's experiences with violence and abuse, this part of the brain is wired for survival. And when it is active, it's hard to think rationally. It's often signs of PTSD and complex PTSD. And basically, what happens is when a person has experienced violence, they are often living in fear and hypervigilance, and they're constantly scanning their surroundings, everything outside of them around what is safe, what is not safe. Their perceptions of things often are is that things are not safe, because they're often reliving uh, their past experiences. So a person could be out of the relationship, but still living in that place of still thinking that they're unsafe and reliving those experiences. So the other part of the brain, the hippocampus, which is responsible for processing memories, it has a very difficult time because that too, because of complex PTSD and trauma, can shrink. And it has a very difficult time separating past trauma from the present moment. So oftentimes, people are living in those past moments, even though they're physically in front of you, their body there, they're sitting in your office, they're sitting in front of you, but they're in the past. And that's what happens to the brain and the body often after repeated experiences with violence and abuse. So if you're not sure if a person's frontal lobe is online or offline. This is something probably you want to get more educated on, right? Some simple things to think about is things around mindfulness, grounding, right? Inviting the person to, do you feel your feet on the floor? Do you notice where your body's making contact with a surface? Do you notice your breath right now? What do you notice as you're breathing, right? Things that are not going to activate. So oftentimes in what I've seen throughout my years in doing this work, we're working with survivors and victims, and we tell a person because they are appearing dysregulated, take a deep breath. And that can be very dysregulating for a person. So think about the context of intimate partner violence, gender-based violence, people that have experienced trauma to their breathing being cut off, so suffocation, strangulation, other forms of violence. So instead of asking and inviting a person to take a deep breath, you might just notice your breath. What are you noticing about your breath? Do you notice as you take a breath, or do you notice the air from your breath, maybe moving through your lips? Do you notice it through your nostrils so that you're not inviting them to take a deep breath? That can be very triggering and activating. And we don't talk enough about that when we're working with survivors and victims of gender-based violence. So that's just one way of possibly bringing the person back to the present moment. When the frontal lobe is offline, when the other parts of the brain become activated, the emotional brain takes over. It's really difficult and near impossible for a person to be in the present moment, right? So trying to invite them back to the space, trying to think about how you might do that, right? With the tools you might have access to. But this is a really important part of screening tools, I think, at intake or screening to see if someone, if you're doing intake calls or on a crisis line or doing an intake with a person, or when you're getting consent forms signed, is a person's frontal lobe online, right? Or is the person in an activated place? So this is another tool, this window of tolerance diagram in my work with survivors and community members and organizations. I believe this is one of the most helpful tools to help us better understand what a person's nervous system might be going through, how they're living day to day, the impacts of trauma. So oftentimes with trauma, complex PTSD, because of violence and abuse, a person has a very narrow window of tolerance. So that middle section there, so when you have a wide window of tolerance, that means that you're able to tolerate day to day, right? Difficult things happen. Maybe crises are happening around you in your work, but you're able to tolerate those things because you have a wide narrow window of you have a wide window of tolerance. You're able to adapt to situations. You're able to be curious, right? It means your frontal lobe is online. Your emotional brain is not taking over. For many survivors, their window of tolerance is really narrow. Oftentimes, survivors of violence, um, are kind of ebbing and flowing between living in chronic hyperarousal and chronic hypoarousal. I think as service providers and in working with folks that are doing gender-based violence work, it's more easy to recognize when someone in front of us is in that place of chronic hyperarousal. So you're noticing the emotional overwhelm. It could look like panic, impulsivity, hypervigilance. They're scanning the room. They're looking for the exits. They're not able to settle. They're not able to sit. They're constantly scanning the room, looking around, looking at you. There could be defensiveness coming up, feelings of unsafe, anger, racing thoughts. So I think those are more familiar for people to recognize. In working with survivors, sometimes when a person is living in chronic hypoarousal, so that's on the bottom there, that can be harder for people to recognize, right? Some people confuse that with a person just being regulated and calm, but it's not that, right? And it's important to know the difference with the person that you're sitting and working with. If they're in their window of tolerance and presence in the present moment, or if they're in that place of hypoarousal. So what does that look like? So really numb and dead, passive, no feelings or energy, unable to think, disconnected, might be hard for them to focus, they're shut down, really not present. Sometimes the person might seem like they're blank, right? Like there's nothing going on, there's no feelings or emotions there, disconnected from their body, and they're unable to say no. That's why that's really important when you're doing screening or doing intakes or doing consent forms. If a person's down there in that hypoarousal, um, and they're unable to say no because they're in that shutdown place, um, the freeze and fawning, and they're not able to say, like, to, communicate their needs, communicate their boundaries. They are people pleasing. They have been conditioned and have internalized that can't say no. That's really important to be having tools to assess for that, to be recognizing that when you're working with individuals. So this diagram also, in our work as social workers, or if you're doing other work where you're exposed to people that are in crisis, that are constantly, working with folks that are experiencing trauma and suffering and pain, trauma exposure responses can result, right? And the impact that the exposure to the work that we do each and every day has an impact on our nervous system. So we can also have a narrow window of tolerance based on our work. And if we're not tending to our bodies and nervous systems based on that exposure and what we're witnessing, we can have narrow windows of tolerance as well in doing this work, and we can be living. And I'm going to say, I do a lot of work with organizations that do gender-based violence work, and we talk a lot about organizations and the staff working within the organizations living in this chronic place of chronic hyperarousal or hypoarousal, right? And how there can be differences amongst the staff teams, like the members of the staff team, right? And who's in that chronic hyperarousal and who's like in that shut down or being disconnected, feeling disconnected from the work. So I'm going to just put this up, thinking right now about maybe, the work you do, or maybe you want to think about even this week, right? Um, where would you say your window of tolerance is at? Do you have a wide window of tolerance? Do you have a narrow window of tolerance? What's your window of tolerance looking like at work? What does it look like when you go home, maybe with family? What does it look like when you're working with maybe more complex and challenging clients or situations at work, right? Is there things that send you outside of your window of tolerance? Is there things that that are triggers for you, right? Or clients that might trigger you? These are important things in doing work with survivors and victims of intimate partner violence and gender-based violence. Awareness of our own nervous systems, how our nervous systems and bodies respond, what our triggers are, what our biases are, what our own, maybe we have past trauma, right? Maybe we have things that are coming up that are triggering us. This is really important. So I put the diagram and I invite you to, you're invited to maybe take a look at that once the presentation is sent. These two tools here, I think, should be in every workplace. I think social workers, people doing gender-based violence work, these two tools can be really helpful for teams for better understanding your own nervous system, understanding the nervous systems of the people that you're working with, can be really helpful, right? So looking at those trauma exposure responses, there's lots of different ways that trauma exposure to the work can have an impact on our relationship with ourselves, and then how that has an impact on the relationships with the people that we're working with, including the relationships with our loved ones and family. So trauma responses and trauma exposure responses are adaptive survival responses, and they are not signs that there's something wrong with a person. It's often the body and nervous system's attempts to survive overwhelming experiences of chronic threat, coercive control, violence, or working in trauma-exposed workplaces. So how trauma responses may show up. So I've talked about a bit about these already, but difficulty concentrating, having an impact on executive functioning. It could look like missing appointments or seeming inconsistent, um, chronic exhaustion, anger or reactivity, difficulty trusting others, numbness, disconnection, dissociation. These are all very show up a lot in working with survivors. The hypervigilance and constantly scanning for danger is why how our body shows up and how our nervous system shows up is so important in our work with survivors. And some other things to think about is common protective trauma responses. So our systems, people working in our systems, we see this a lot, right, with survivors who, for many reasons, right, they might, because of their trauma, because of their experiences and what they have internalized, they may recant or change their disclosure, right? And that oftentimes is a protective trauma response. They might protect or defend or return to their abusive partner. This is very common, right, in working with survivors of intimate partner violence and gender-based violence. Oftentimes, in working with marginalized survivors, is that there is real fear of how how policing will respond to their partners, right? So they're wanting to protect, right, their partner. They might minimize or normalize abuse. And I would say that this is very common. This is misunderstood. This gets pathologized and weaponized against individuals is when people don't share everything when they first meet, a social worker, a clinician, when they meet with the police or they meet with another service provider. They're minimizing or normalizing. This is a protective trauma response based on their experience with violence. I think it's important too that this one, families that have their loved one has been taken to intimate partner violence or gender-based violence, they will say that, there was no signs, or, sometimes there was signs, but sometimes people will say there was no signs. And that's because survivors of intimate partner violence and gender-based violence can take on these protective parts that are really good at masking, right? And that can show up in treatment, that can show up in your work as a social worker. So they mask their experiences with family, friends, and professionals. Fawning, appeasing, or avoiding conflict. So again, this is very common, and oftentimes a survivor of violence, is more comfortable being in that place because of the uncertainties, right? Or the previous experiences of when they might have, communicated their needs. They might have said no, and how violence might be connected with those experiences. So very consistent with just saying yes to things and trying to people please. Um, Other things could be withdrawing, isolating, or avoiding support. Um, and two, there's many survivors and folks I've worked with over the years taking responsibility for the abuse. Um, and we'll talk a bit more about that in regards to attachment trauma and some of those things that might be coming up. So, attachment trauma, gender expectations, and internalized beliefs. Experience of violence are often occur within broader social and cultural messages about gender responsibility, caregiving, and worth. And these are just some ways survivors may internalize beliefs about themselves. And some of these internalized beliefs happen at a very young age, right? I am responsible for keeping others happy. My needs do not matter. It's my job and responsibility to keep my family together. I put everyone else's needs ahead of mine. My needs are not important. Good partners make sacrifices. I got this one down here. If I speak up, I will be heard, abandoned, judged, or disbelieved. This is very common. And I think the part about abandonment, we don't talk enough about intimate partner violence and forms of gender-based violence from an attachment lens. That individuals that have those earlier experiences with attachment trauma, so abuse from a caregiver, a parent, or guardian, or those traumas that happen at a younger age, there is this real fear that so they know they're in an abusive relationship, they know they're in, and sometimes in a high risk for lethality situation, but the fear of being alone and abandoned is actually the thing that they're most concerned about, right? And that I'm going to say that too often our services are set up for after a person, so a woman or a gender diverse individual or a person leaves the abusive partner. Um, but more work needs to be done about individuals that are living in abusive relationships and have these attachment wounds and the things that are keeping them because of what they have internalized and what they have experienced from things that have happened outside of their relationship with their current partner or past abusive relationships. So those earlier experiences can really have an impact when a person is in an intimate partner violent relationship. Um, these beliefs are often reinforced by attachment experiences, coercive control, gendered socialization, and systemic messages about who is expected to care, accommodate, endure, and sacrifice. And I would love to talk more about this, but I need to put this up here because this happens so much, right? And I'm just going to name. I have met many social workers, professionals throughout my career because of the work I do, where people are victim blaming and pathologizing survivors. Traumas and their trauma responses. So we live in a world that often denies, minimizes, and invalidates and silences experience of trauma and gender-based violence. The rise in extremist ideologies, increasing misogyny, and growing resistance against gender equity are contributing to these dynamics within professional institutional spaces and across society. And this is real, and we're really feeling this. I think this is on the rise. Things have shifted. Things have not been great, but we are seeing a shift towards more extremism, more misogyny happening in society, how people view women, the hate directed at women and gender diverse individuals. So this is real. As a result, survivors may encounter disbelief, victim blaming, pathologization of trauma responses, and systemic barriers to support. Trauma-informed practices require us to recognize these broader contexts and to actively create conditions of safety, validation, dignity, and accountability. So just thinking about what might survivors internalize about themselves from others, and what might a survivor internalize about themselves from maybe an encounter with you, right? Maybe it's in the work you're doing with them, right? Maybe it's something you have said. Maybe it's a belief that you hold about gender-based violence. Trauma responses are often pathologized. And again, I could talk all day about this. This is really important, but trauma responses are frequently misunderstood and labeled as non-compliant, resistant, difficult, manipulative, attention-seeking, unmotivated, borderline. too emotional or not emotional enough, right? So when trauma responses are pathologized, work with survivors shift from understanding the harm they experience, the violence they experience, to really managing the behavior, right? And that is a problem. And I just, I got some stars there around borderline in my work with, especially since, shifting from more crisis work to doing trauma therapy work with folks over the last number of years, is that many individuals I have met when I was doing frontline work had this diagnosis of borderline. And now, in doing trauma therapy work with folks, um, people get labeled with borderline personality disorder. And oftentimes, they don't have a diagnosis of complex PTSD. And in all of these cases, a person has an extensive history with either intimate partner violence or maybe intimate partner violence, other forms of gender-based violence, and attachment trauma. Borderline personality diagnoses are, I'm just going to say, our systems. When people are seeking services at hospitals, when police might be responding, this diagnosis and label is highly problematic for survivors of gender-based violence. And oftentimes, people are not seeing the trauma and the violence. And because of their borderline personality disorder diagnosis, it prevents people from getting help and services that they need. So more work, you know, if you're interested in advocacy work and, not familiar with this or, wanting to learn more, there's a lot of work I believe that needs to be done in our province around this piece. This is not, I'm going to say when I bring this up in my advocacy work, there's a lot of defensiveness, including from social workers and clinicians, psychologists, psychiatrists, our mental health system around this, but we need to be looking at this through the people that have been impacted by gender-based violence, intimate partner violence, and have attachment trauma, and really understanding that and ensuring that people are getting the treatment and the services and supports that they need. So how are trauma responses weaponized against survivors? There's so many. I had so many on this list. I tried to make it, as short as I could here. Examples: hypervigilance interpreted as paranoia. Emotional expression interpreted as instability. Memory grabs interpreted as dishonesty or a person lying. Self-protection interpreted as aggression or them being the abuser. Freeze responses interpreted as consent or agreement. So again, thinking about that freeze response when you might be doing paperwork, consent forms, intake forms with a person, right? Difficulty engaging in difficulty engaging, being viewed as a lack of commitment, right? They're missing appointments, they're not showing up, they're showing up late, right? That gets weaponized against individuals. These very adaptations have helped a person survive violence, and it can later be used against them in systems, workplaces, courts, healthcare, and in helping professions. And I wanted to talk more here about C16, which is we're now going to have, well, it's now in place, and it will be coming around the criminalization of coercive control. This is concerning for me for many reasons, but I just want you to maybe think about how someone's trauma response is when a person's in a coercive controlling relationship, and now with coercive control being criminalized, how that potentially is going to be weaponized and used against individuals that are experiencing intimate partner violence and gender-based violence. And our systems already lack understanding of trauma responses and the impacts of trauma and violence on people's nervous systems and bodies. So these new changes that are going to be coming is really concerning about the negative impacts. So yes, good can come from this, but we also need to think about how this is going to be weaponized against women and gender diverse individuals, and especially marginalized women who are experiencing violence and abuse, and when they might be trying to protect themselves or their trauma responses are showing up in their relationship. And just going to briefly mention here, a lot of people have not heard of this when we talk about trauma, but interoception is really important. So it's the ability to be able to sense your body. Um, and this, what is happening within your body. And it's not developed in isolation. It is shaped by our environment and our relationships. And when a person has experienced violence or you have experienced exposure to trauma, violence, pain, suffering in your work, your nervous system adapts in ways that prioritize survival. These are not failures, these are protective trauma responses or trauma exposure responses. The insula is so, if you're curious about where it's at, if you think about your hand here being the brain, it's kind of in this section. So, what does it do? Why is it important? It is an important bridge that generally links body sensations, emotional experiences, and awareness to what is happening inside. So, things like being able to notice and interpret your body signals, such as hunger, fatigue, pain, emotions, safety and danger, boundaries and needs. But during violence and abuse, survivors can learn to disconnect from these signals within their body and because it's not safe, right? So communicating their needs is not safe because it's been met with violence. Uh, Sharing with, maybe their parents, right, or guardians or their partner about their emotions is not safe because then it's met with rejection or abuse. So over time, these interoceptive awareness can become eroded. Survivors may struggle to notice what they feel, what they need when they're overwhelmed, what feels safe or unsafe. Why does this matter? So, interoception. So, a survivor really disconnected from their internal system and nervous system. Exteroception, very aware of what's happening around them, with the people in their life, their surroundings. Why our bodies, why our nervous system, and how we show up is so important. If you're working with a survivor, you're meeting a survivor, they are going to be, they're not aware usually what's happening inside. They're constantly scanning for what you're doing, what's happening in the environment around them. So how your nervous system and body shows up matters. How you, what does your body and nervous system share? Is it urgency, right? Is it you're overwhelmed? Is it signaling to them that you don't have tolerance or you don't have a container to hold um, what they are experiencing, their emotional overwhelm, their defensiveness, maybe their anger? Can you hold that, right? Do you have enough tolerance to hold that? Or are you shutting down? Are you disconnecting from your body? Are you, signaling urgency? Right? These are things, and there's lots of different ways of looking at this, but these are things that can really prevent people from continuing to seek help. They're so aware. And what do they then internalize about what your nervous system and body is telling them? So if you're showing up, late, if you're always rushing, oftentimes survivors of gender-based violence and intimate partner violence, what they internalize from that is that I don't matter, my situation is not as important as others, I'm not important. So it reinforces those wounds that they have already experienced, either in their attachment trauma or with their relational traumas within their relationship. So important to note here, not all survivors of intimate partner violence have attachment wounds or attachment trauma, but many survivors have had healthy relationships before experiencing violence. Their trauma responses may be a result of repeated exposure to danger and relational violence, coercive control, betrayal trauma, fear, loss of autonomy, or harmful and invalidating systemic responses or disclosures, right? And I call that system-induced trauma. Our systems really do cause trauma, cause re-victimization, and keep people in this constant place of experiencing betrayal and harm. So why, like, if a person has had has experiences with attachment trauma and then is in an intimate partner violent relationship or relationships, um, it has a different impact than people that experience relational violence at a later time in their life, right, with a partner. So the fear of abandonment or rejection are usually seen more intensely. They have difficulty trusting themselves and others. The strong need for connection and belonging, and difficulty with boundaries. Um, Attachment wounds do not cause intimate partner violence. The responsibility for this violence always lies with the person choosing to use violence. However, attachment wounds can shape how survivors make sense of, respond to, and recover from their abusive relationship. I'm just going to skip over this here. Um, so some takeaways here. Trauma responses, just need to say, are adaptive. As social workers, recognizing these survival responses, I think, is really important. We need to avoid pathologizing language in our work with survivors. And I do believe that there's a lot of work to be done around non-coercion, how non-coercion shows up in our language, how it shows up in our intake forms, how it shows up in our organizational policies and practices, and how we really embody choice. There's so much work to be done, even within gender-based violence spaces around this piece. But, thinking about coercion can show up in policy. Coercion can show up in your intake forms. Coercion can show up in how a person accesses services. Understanding the impact of violence on the body and nervous system is really important. And by creating the conditions, being a safe body in a room with a survivor, it supports reconnection and it helps them with reconnecting to their interoceptive awareness, which is key for healing. And centering safety, dignity, agency, and relational healing. So, as social workers or helpers or carers, our bodies are one of our primary tools for connection, attunement, and support. The nervous system of survivors are constantly gathering information about safety and danger. Often this occurs outside of their conscious awareness. When we are chronically stressed, overwhelmed, rushed, or disconnected from our own needs, it can affect how we show up in relationships and help survivors. So, if that's causing some dysregulation right now, or maybe you're noticing defensiveness with that, or maybe being like avoiding or numbing or don't want to hear that, I'm inviting you to think about that, right? And how your body shows up in relationship with the people you're working with, right? And are you aware of when your nervous system might be doing better than days when you're overwhelmed or stretched past your limit? That's really important. And it's really important in your work with survivors of gender-based violence because of how extroceptively aware they are. So again, they're usually not aware of what's happening internally. They're aware of everything happening around them, and they are experts at that because that has kept them safe, right? Safe from their partners, always paying attention to what their partners are doing, the partner's movement. When is the partner's tone changing? When is the abuse happening next? Or if it was a parent, right? They get really good at being aware of those things. And they are aware of that when they're working with professionals, whether it's therapists, social workers, counselors, teachers, it really doesn't matter. So they're really aware of that. So how you show up, if you're a friend or a family member, how you show up in that relationship, how your nervous system and body shows up, I believe is the most important thing in building and being a trusted body and safe body with that person. So your pace and presence, your facial expressions, your tone of voice, are you able to stay grounded when they're experiencing distress? Our capacity to tolerate their emotions, nonverbal cues of tension, anxiety, or calm. How do we respond to relational ruptures? I can talk all day about that, but I'll just put it there on the slide. How do you respond when there's a rupture within the relationship with the person you're working with? And our nervous system communicates as much as our words. And you can review this here. Caring for your body, your nervous system is so important. So you can take a look at this slide, just looking at time here. But I just wanted to end with, I think it's so important that Judith Herman has done so much work with survivors of intimate partner violence and gender-based violence. And I love this quote of the core experience of psychological trauma are disempowerment and disconnection from others. Recovery, therefore, is based upon the empowerment of the survivor and the creation of new connections. And that starts with us. So, as social workers, if we have the privilege of working alongside survivors and victims of violence, it's why trauma sensitive relationships are so important in our work and why caring for our own body and nervous system is as important, or actually sometimes more important, that we're in that place of being ready to hold a container to do this work with the folks we're working with. So thank you so much for joining today. And I'll turn it back over to Frankie, but I'm always around if people have questions. And I hope some of this or all of it or parts of it were helpful to you.
Okay, great. Thank you so much, Christina. Um, just a moment here. I'll take things back over here. Go. So, yes, once again, if anyone wants to access today's presentation, they can do so. Oops. On this slide, we have the QR code as well as a link. Rebecca will also be sending around a link to the presentation as part of the follow-up email to all attendees. As well, we want to do a quick checkout, so feel free to answer in the chat what you're taking away from this session, anything you're still curious about, and anything else you want to share as we wrap up our time together today. We'll make sure that this will all, you know, get back to Christina. Oops, a little too fast there. Oh, gosh. Okay. We also would like you to take some time, if you could, to please fill out the evaluation regarding today's lunch and learn. You can do so by scanning the QR code here or using the link when you do get access to the presentation. As well, on this slide, you can see we have a couple of other upcoming webinars and events. So we've got a couple coming up, quite a few in July, looks pretty busy. And then we have a workshop on coercive control and helping and healing practices in September. So make sure to save the date for that. As well, you can always find out more about our upcoming events by following, liking, and subscribing to the college on social and communication channels so that you can stay informed about these professional development opportunities. As well, T likes to put in this little slide at the end, just something from the Wild Seed Society, so everyone can always, think about how liberation, happiness, and freedom are all possible in your body, in this place, and at this time. So, yeah, thank you so much, everyone, again for joining us today. Thank you all for being patient with me as I helped facilitate here. But we are very glad to have had you all, and I hope you all have a wonderful rest of your afternoon. All right. Thanks so much.